Hi, I'm Martine Cotte from Mauritius. I'm the Assistant Rector of the Loreto Secondary School for Girls. I'll be talking on Goal 3, which is to ensure healthy lives and promote well-being for all at all ages. Significant strides have been made in increasing life expectancy and reducing some of the common killers associated with child and maternal mortality. Major progress has been made in reducing malaria, tuberculosis, polio, and the spread of HIV/AIDS, which is a communicable disease and other cause of mortality, being infectious and contagious. Complications in pregnancy and childbirth are the leading cause of death among adolescent girls and women in developing countries. It is particularly important that all births are attended by skilled health professionals, as timely management and treatment can make the difference between life and death. More than 6 million children still die before their 5th birthday each year because they are born in poverty and because their children are mothers with no education. Good sexual and reproductive health is a state of complete physical, mental, and social well-being in all matters relating to the reproductive system. To this end, people need access to accurate information and the safe, effective, affordable, and acceptable contraception method of their choice. They must be informed and empowered to protect themselves from sexually transmitted infections. And when they decide to have children, women must have access to services that can help them have a fit pregnancy, safe delivery, and a healthy baby. Young people are also extremely vulnerable, often facing barriers to sexual and reproductive health information and care. Every year, millions of girls face unintended pregnancies, exposing them to risks during childbirth or unsafe abortions. Another cause of mortality is the use of substance abuse, which is the harmful use of psychoactive substances, including alcohol and illicit drugs. Substance abuse may start in childhood or adolescence. Abuse prevention programs seek to increase communication between parents and their children, to teach resistance skills, and to provide information in order to correct children's misperceptions about cigarettes, alcohol, and drugs and the consequences of their use. Sustainable financing for essential medicines must be viewed in the context of overall healthy care policy. Governments in developing countries should aim at building capacities for the development, negotiation, implementation, monitoring, and evaluation of comprehensive national health policies, strategies, and plans with a view of promoting universal health coverage, people-centered primary care, and health for all, which is essential to sustainable development. Now I'll be talking to the 4th goal, which is to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Good quality education is one that provides all learners with capabilities they require to become economically productive, develop sustainable livelihoods, contribute to peaceful and democratic societies, and enhance individual well-being. Quality education is a crucial factor in reducing inequalities, combating poverty, while supporting the expansion of more just, inclusive, and sustainable societies. Basic education should consist of at least 1 year of pre-primary and 9 years of free, compulsory, and continuous primary and lower secondary education, and should be provided to all without discrimination based on gender, ethnicity, religion, disability, language, or location. To this end, it is expected that by 2030, at least 10 years of basic education will be made compulsory in all countries, and that upon completion of the full cycle, all children will have acquired the basic learning outcomes, including a set of foundation skills. Technical and vocational education and training, the TVET, can play an important role in economic development and poverty reduction if due attention is given to adapting or targeting education and training provision to local needs. Skills development provides individuals with a better chance to obtain productive and profitable employment, thereby sustainably increasing their earning power and access to a quality life. Youth and adult literacy remains a key global challenge. It aims at ensuring that young people and adults across the world acquire relevant and recognized functional literacy and numeracy skills that allow them to identify, understand, interpret, create, communicate, and compute using printed and written materials relevant to all learners according to the context in which they live. Leaders should establish learning environments that are safe, gender-responsive, inclusive, and conducive to learning by using mother tongue-based multilingual education. Well-trained and motivated teachers who use inclusive and participatory pedagogical approaches should be able to strengthen capacities for learners to be innovative and creative, and to assimilate change in the society and the workplace, thus reinforcing the ways education contributes to peace, responsible citizenship, sustainable development, and intercultural dialogue. We need to achieve this goal for every child. It is both an opportunity and a duty. We have to take action and make the world aware of the importance of global education. Thank you.